It's really important to think about treatment of schizophrenia as a all hands on deck or team approach. And it is super important, especially in the early stages of treatment, when someone has been newly diagnosed, for them to have a loved one helping them to advocate for their care. It's a pretty scary time. Sometimes there's also the issue as it relates to lack of insight, or even there might be still some active symptoms where there is a disconnect from reality. And so having a loved one help you to make decisions as it relates to your care, taking in all of the information, using it to make an informed decision is really important. So if you have someone who's new to treatment, new to the diagnosis, there might be a lot that's required in terms of helping them to organize their appointments, organize their treatment, help them to also make, good informed decisions about their treatment plan. It may be a lot of work to help them grapple with the fact that this is happening to them and what changes that they experience, whether it might have been taking some time off of work or taking some time off of school, moving back home. All of those things can be really challenging. And so helping and supporting them through that, maintaining a positive outlook is really helpful. What I would strongly encourage is not to suffer in silence and try to do this all on your own. And so building a support team or network could be a system of family and friends. There are also professional organizations such as NAMI that provide support for caregivers who are taking care of loved ones. And then there's also community resources, whether there is something in your community, your place of worship, that may be able to offer supports for you. And we can help our loved ones adhere to their treatment plan by supporting them with coordination of their appointments, helping them to devise a routine and a system through which they will be able to consistently take their medication, helping them through conversations identify when symptoms might be getting worse, where they might need to make some changes, and that teaches them how to advocate for themselves. If we can help them through being supportive, this will give them the best chance to have the best outcomes and to resume their prior level of functioning, whether it's at work or school or within their own family. Once they get settled into their treatment and their routines, it's going to be really beneficial to be able to gradually pull back on your overall support so that they can begin to exert their own independence and autonomy and advocate for themselves.